Many Ugandans, including prominent leaders, seek treatment abroad. But some politicians have previously called for a ban on state-sponsored medical treatment abroad. A Ministry of Health survey in 2014 estimated that Uganda was losing about $73 million annually to medical tourism, a figure believed to have risen since then. The Aga Khan Hospital, whose groundbreaking is set for this week in Nakawa, is expected to help reverse this trend by providing advanced treatment locally for conditions such as cancer, cardiac diseases, and other specialized cases that have previously seen Ugandans travel abroad.
Especially the diseases that have been noted to be on the rise. We normally refer to those as non-communicable diseases. Again, those are the cancers, cardiovascular diseases. You have seen us step into the space of kidney care. We will be doing that at a much larger scale in the hospital. We highly subsidize this service for the interest of the common Ugandans. Therefore, even when the hospital is fully established, we will still consider the cost aspect.
The first phase of the project will be a 101-bed capacity hospital with room for expansion to meet the growing demand.
Some of the services that are super specialized might not necessarily begin in phase 1, but as we develop, we'll be able to step into areas like transplants. And I think the one that has been on high demand in this country has been the bone marrow transplant. That is expected. We hope to see that in one of the phases, probably phase 2.
The hospital will be staffed by medical experts from Uganda and other countries.
We have already started seeing doctors from South Africa and Canada calling in and say, are you ready? Should we come back home? So that is the hope and that is the excitement that we have as an institution to see that we are not only providing a service to Ugandans, but we are also bringing our own back home.
The Aga Khan University Hospital Nakawa Specialty Center that is up and running, whose construction began in 2023, will also be officially inaugurated this Thursday. The center has already attracted patients not only from across Uganda, but also from neighbouring countries such as Rwanda and Burundi.
Because even as we speak right now, our existing facility is constrained. We're running out of capacity to offer the services due to the demands that we see.
Aga Khan University will also be officially opened this week.
The university has put up a new facility, purpose-built university spaces, looking at both university center spaces and accommodation spaces where we are able to run our programs, but also be able to accommodate our learners.
What we need to do here in Uganda is create the knowledge through research that is relevant for Ugandans, that will benefit Ugandans here in Uganda. And access. So access to high quality education and access to high quality healthcare.
Officials say more academic programs will be introduced at the institution, including courses in journalism and communication.
The programs initially started as programs for the School of Nursing and Midwifery, but we look forward to grow that portfolio into programs that will target other schools that the university has already had development into. For example, we have an Institute of Education Development in Tanzania that we're optimistic that will also be able to come to Uganda. We have a Graduate School of Media and Journalism in Nairobi, Kenya, that we're optimistic will also be able to come to Kampala.
Norbert Atkunda, NTV News.